The member for North West Central.
Thank you, Deputy Speaker. And today I grieve to the Minister for Health, and I thank you for taking my grievance. I'm seeking answers to the number one question that I'm asked across the electorate in the North West Central, and I know that you're very aware of this situation and the difficulty we have in the North West. The question that people ask me is, at a time of billion-dollar surpluses built on the back of regional WA, why do our communities continue to be plagued by inadequate or difficult access to health services? An issue that not only negatively impacts patients and their families, but has flow-on effects to population retention and attraction, tourism and the broader positive regional development of our region. The Carnarvon Hospital, the major health facility for at least 500 kilometres that services the broader Gascoyne region, but with limited specialist services available, including the no maternity services, which you're well aware of. After 12 months, the question that people have been asking me is the Health Minister able to provide us with some kind of timeline of when the scaled-back services may be reintroduced, which would provide some direction for them? Given yesterday, I know you said that you were very aware that it's a temporary measure. Well, it's 900 kilometres to Perth and nearly 500 kilometres to Geraldton each way. Often the travel, the costs and the logistics involved in that, particularly for elderly patients without family support, are enormous. And it's something that's actually probably not experienced in any capacity in the metro areas. But being remote and away from extended family, friends and support networks, I think we deserve some additional support to ease the difficulty when people are unwell, especially when they're critical, given it's not possible to make the health services available locally, which people do appreciate. On top of the lack of maternity services, earlier this week I was contacted by concerned mothers about the provision of child and family health nurse services in Carnarvon, which from on-the-ground feedback, seemingly these services have either been scaled back, postponed or are not able to be provided in recent times, with some of the mothers unable to access immunisations for their babies, which is something they found particularly distressing and concerning. Minister, I wanted to note that when my children were small, I was very fortunate to have the services of two amazing nurses in particular, in the name of Beth Hudson and Erica Preston, who were incredibly dedicated health professionals, and they still play a critical role within that health service for new families, and clearly the feedback that we need is to bolster or find a way to work together to bolster the services for particularly the young babies and the young children and young mothers where we can. So, Minister, I know you implicitly understand the health services are such a fundamental building block of any community that getting it right is just too important to be plagued by delays or incompetence. So I ask you, Minister, how we can work together to be creative in finding solutions to ensure that at least one full-time child and family health nurse is available to provide services at all time at the Carnarvon Health Campus or alternative venue. We have families in Carnarvon and beyond that have not been able to get the immunisations, and we just need to help them to find a solution. Happy to work with you on that. With the current challenges under delivery of the services, it triggers concerns from the community around the PATS travel system, which is vital in the huge and remote electorate in North West Central. So without access to locally PATS, it's a critical program for regional residents, and simply, again, it's just not enough in this climate. So there's some steps that I'd like to ask you to consider to ensure the program, which is improved under the Nationals in government at one point in time, so that it continued to be fit for purpose. So by way of example, I'll raise the concerns of Glenn Haves, a Denham local who is supporting his wife Judy as she undergoes ongoing cancer treatment. Glenn raised with me some genuine concerns around access to taxis when travelling for treatment, the fuel subsidy offered and the processing delays of reimbursements. Glenn and Judy have received taxi vouchers in the past, but it's at the discretion of the manager in Carnarvon, and the processing times to receive these vouchers has meant they haven't been received ahead of treatment. Glenn asks that these vouchers should be mandatory, as they're essential in being able to access treatment in Perth after travelling 800 kilometres for regular ongoing treatment, and that it shouldn't be a case-by-case discretionary item, a point which I think is fair and I agree with. Judy is currently on a block of 6 weeks of chemotherapy treatment and isn't allowed to drive after treatment. So to expect her to use public transport to rely on others so far away from home isn't fair or realistic. Glenn is staying in Shark Bay as Judy is in Perth, and she has treatment once a week and travels back and forth, which would be too much, but the separation doesn't make it easier. On top of these challenges is the fact fuel cost subsidy to travel is woefully inadequate. At 16 cents per kilometre, with fuel prices in Shark Bay at $2.24 for diesel, if you do the maths, it doesn't get you far. So with the ATO rate at 67 cents per kilometre, I ask that when was the PAT subsidy maybe last increased, and if there is the space to actually increase that subsidy for regional people. Before you mentioned travel, you mentioned the travel. I was told that Judy is not actually able to travel by air in the case that she has adverse health impacts. So, Minister, the kicker as well is that it takes 6 to 8 weeks to have these costs reimbursed, which is actually causing enormous distress for many pensioners and is one that impacts a lot of other people as well. So I would just ask lastly, following on from the example of Glenn and Judy, if we can look at a more generous and easily accessible taxi voucher system for patients who need to come to Perth and the large regional centres. In closing, I just want to thank you for taking my grievance, Minister, and I want to reiterate that I'm very happy to work with you because my community just wants outcomes, and I know that we can find alternative ways if we look outside the box to find some solutions to make it easier and affordable, with more affordable transport options, better transfer services, post-treatment and on-the-ground support in the city for those that need to travel long distances, particularly for our vulnerable seniors who arrive in Perth on their own. And I look forward to working with you, Minister, to ensure our community gets the focus of your government to address issues unique to our regions so we can dispel the view that our health in our community is not the focus of your team. And I thank you for taking my grievance today.
Minister for Health.
Acting Speaker, I thank the member for North West Central for the grievance and appreciate the advocacy on behalf of her community. And yes, I acknowledge that healthcare is one of the underpinning factors of success of any community in attracting families and growing the local economy and community there, and that's why we do invest in regional healthcare. There's a few issues raised there, so I'll try and cover off on as many as I can. In terms of the child health family nurses in Gascoyne, there hasn't been a scale back of the service. There are 3 FTE clinical nurse community health nurses based in Carnarvon with 3 FTE based in Carnarvon, 0.8 FTE based in Exmouth, but it's while the Exmouth component is filled, Carnarvon only has 1 FTE filled. So it's not that the funding's been scaled back in any way; it's a recruitment issue, as we see across the as we see across the system. Multiple recruitment processes have been undertaken over the last 3 years to fill the remaining 2 positions, including attempting to secure further agency nursing support, urgent requests sent out to WACS community health nurses to support Carnarvon via short-term secondment, allocation of time by the site by the on-site public health nurses to support the provision of immunisations, and support for new mothers from the MGP for the first 6 weeks post-birth, and discussion with local medical practice and Aboriginal Medical Service to upskill and support them to provide the immunisation in primary care. It is acknowledged these are really important, particularly those early immunisations. So WACS is working creatively across services to try and make sure that people have access to those while we fill those positions. And I think the permanent position holder had to take some unplanned personal leave to deal with a family emergency, which meant that there was no presence. There hasn't been a presence of the clinical nurse, community nurse. So that will be why the community feels it's been scaled back. It hasn't. It's a recruitment issue. We're aware, and we're working on, and WACS is working on it urgently. Acknowledge that is undesirable, and that needs to be resolved. It's anticipated there will be a community nurse back on site within the next 3 weeks, and there continues to be Aboriginal health worker community health on site throughout the time, monitoring the support for Aboriginal families, and WACS is continuing to seek opportunities to cover the current service across the Midwest, and we're actually undertaking a structural review of the Carnarvon Community Health Services so that we can identify where we could potentially modify the current model and improve the ability to recruit into those positions to make them more desirable. And it's also involved the creation of a level 1 registered nurse that can be supported to uptake the required further training under a grow your own model. The maternity services continue to be challenging, and ultimately, we're very committed to continuity of care. It is challenging in small communities. There's a national shortage of midwives, and that continues to challenge regional communities. So the midwifery group practice opened in Carnarvon and commenced on the 3rd of May 2021. Now, that was intended to, there's also GP obstetrics available. Now, one of the perverse outcomes of providing more choices is that there's less work for people to do when there's a finite number of births. So the reality is there's around 100 births per year in Carnarvon. I'm encouraging people to have more babies in Carnarvon. The more babies we can, more babies is welcome because we're able to increase the number of births. And midwives need to have a minimum number of births to maintain their currency of practice. So it's a registration issue rather than a recruitment issue, if you like. So this is a very challenging one, and it's right on the, it's just right in that middle area, in the grey area. So we really do need to, we're working creatively and doing a review of those and how we might provide. And there is a review of obstetrics and maternity services in country health services, and they are very supportive of looking at what's a sustainable model that also provides continuity of care. So it's right in that grey area where there's just not enough births to maintain that midwifery group practice and the GP obstetrician. So we're working through that. So the normal birthing service is based on the model of retaining low-risk women in the community seeking a vaginal birth or vaginal birth after C-section, and those moderate to high-risk women travel to Geraldton or Perth, and that requires further support. It's not ideal, and I acknowledge that, that's very challenging. And we're certainly focused on it. I can't give you a date or a deadline. We are working through it. I'm trying to be very open with you here that this is a complex issue, and it's not just about recruiting. It's about their registration requirements and having enough births. And the question that I ask the service is, well, are there midwives who are willing to work across towns that will give them give them the number of the practice that they require to maintain their competencies. So we do, the health service does support women to travel with 100% accommodation expenses paid above the PATS reimbursement, and try and facilitate that. And if there are examples of where that isn't happening as smoothly as it should, then please contact my office. We're very happy to work with your office on making sure those women are getting what they need in terms of that reimbursement, and we'll continue to work with you on how we can redevelop that service or reinstate that service. PATS has had a significant increase under this government. I was part of an inquiry, government-led inquiry in opposition, which had a range of recommendations for the former government to implement, and it was shelved. So this government has increased that the rebate, and it's going up by CPI, so it's over $100 per night. Now, your point about taxi vouchers is valid, and certainly taking 6 weeks to reimburse, I'm very happy to take that up with WA Country Health Service and see if they can improve on that. That seems like an unnecessarily long period of time. But it is a complex area. I'm very happy to continue working with you on how we can make it easier for your constituents.